friends, I'm Galzeerah. This is a video to discuss things that you can do to help chronic conditions or injuries of the wrists and hands. Wrist and hand complaints are very common. We use these joints and muscles all day long. Repetitive overuse is very common. Acute injuries, just chronic conditions, chronic inflammation, degenerative conditions such as arthritis. So this is a video to kind of address some broad strategies that you can use to help a variety of complaints. Just a disclaimer, if you have a very recent traumatic injury, none of these interventions should do you any harm. But if it's very severe, get it checked out first, especially if it was a trauma such as a fall, just to make sure that you don't have a fracture or something that will need more invasive help other than just some self-care and rehab strategies. But this video is great to address rheumatoid arthritis, osteoarthritis, chronic strains, tendonitis, tenosynovitis, all the itises. And also I had a friend on Facebook ask me for strategies to help with trigger finger, which technically is a chronic tendon problem. So all of these, as long as you do the exercises and stay within your pain-free intensity, are perfectly safe. They will help somewhat. They may not be comprehensive to your specific problem, but they should at least help you. So the first strategy is a warm soak. So this is very simple to do. Clean bowl, basin, fill it with not steaming, but warm water, and soak the hand in it. 10 to 20 minutes is perfectly sufficient. You don't want it too hot. It's great if you can kind of move around while your hand is in there. Another good add-on would be to put some Epsom salts into that warm water. So that's not just for wrist and hand problems. Epsom salts can go in your bathtub or your foot bath. It's great to get rid of inflammation. There is some evidence to Epsom salts. The science behind it is that this is magnesium sulfate. When a magnesium-containing compound goes into water, it ionizes, so you have the magnesium that breaks apart from the sulfate and becomes a positive ion. And forgive my science, I think that's called a cation, and anion is negative. If I have it backwards, forgive me. It's been a while since I studied that. But anyway, the idea is that you have magnesium that has a positive charge floating around in the water. The beauty of that is all of your inflammatory products in your body have a negative charge. So all of your histamines and cytokines, everything that your body secretes in a troubled area, will get attracted to the magnesium and drawn through the skin. So it does help reduce inflammation. That's how that works. So a really good strategy for hand and wrist injuries, because the blood vessels and the lymph vessels are so tiny, is to really get the fluid moving. So you can do just a warm soak, but even better is what we call contrast baths. So you would have 2 containers, one warm water, quite warm, not steaming hot, and then the other would be cool, not icy. We don't need to give ourselves frostbite, but just cold water out of your tap. So then the idea is that you are in the warm water for 2 minutes. All of your blood vessels expand, you get more oxygen into the injured area. It helps open things up. Then you stick it into the cool basin and vasoconstriction happens, so everything will close up, and that helps to really pump all of the extra swelling and inflammation out of there. So recommended parameters, typically 2 minutes warm, 30 seconds cold. If you can do it about 6 to 8 times back and forth, 2 minutes warm, 30 seconds cold, that's great. Even if you only have time for a couple repetitions of that, that will really help move things along. So contrast baths, great for wrist and hand problems Sometimes I'll suggest someone do it for an ankle or foot too. Just the idea of warm then cool, warm then cool. That moves fluid. All right, so the next strategy is an exercise called Tendon Glides. This is great if you have somewhere very local, if you know that you have a tendonitis right in one spot, or trigger finger. So a Facebook friend of mine asked if I could do any education on trigger finger. So I'll throw that in here where it's relevant. A trigger finger is basically a ball of inflammation in a tendon that kind of lasts a long time. So these tendons that flex all of your fingers, they actually are attached to muscles that come all the way from the elbow and forearm, but into the hand because there's not much room. They kind of fan out into tendons. And to keep the tendons in place, think of basically like a rope that has like little U-clamps keeping it in place. And then when you move, the rope stays kind of right under like a pulley. When you have a tendon injury or a repeat injury that just for whatever reason doesn't heal well, keeps getting inflamed, keeps getting re-injured, oftentimes that tendon, the sheath around it, will kind of get inflamed and ball up. So a trigger finger is kind of a ball of scar tissue and inflammation that's just having trouble healing up. So when you try to move, the rope basically has a small knot in it. So it gets stuck under the pulley, and then it takes a little extra effort or kind of relaxing the tendon and then moving it manually to get it to move. So tendon glides can be good for any tendon problem, but especially for trigger finger. So basically, I'm going to move in so you can kind of see a little better. Say this is a trigger finger here. I have trouble in this joint, imagine. So basically you want to isolate the joint below and work on just moving that one. So finger flexors, hand flexors are very complex because they cross several areas. They come often all the way from the elbow. So they start there, they cross the joints of the wrist, they cross the joints of the phalanx. So they have several areas they cross. So sometimes putting slack in the tendon, so you're not totally extending it or totally flexing it, but kind of keeping it neutral and then just working that one area. And you can even do it passively. So if you can't do it actively, you can use your opposite hand to help. So stay within your pain-free range so that you're not forcing it, and try for maybe 10 repetitions. You can do the whole hand at once and just kind of isolate one set of joints the best you can. So those are tendon glides, and that will help kind of get things moving. Trigger finger is stubborn. Sometimes it may just be with you the rest of your life and you try to manage it. Sometimes they heal. Sometimes you might want to try some anti-inflammatory strategies, and that would require you to see your healthcare provider. Cortisone injections or a course of anti-inflammatory meds, but that's beyond the scope of this video. However, contrast baths, tendon glides, 10 reps a couple times a day, that will at least help you, if not solve it completely. So another exercise is strengthening. So strengthening the wrist and hand. One easy way to kind of get all of the small hand muscles, dishcloth, roll it up, and now you have something to grip. And just repeat 30 seconds to a minute, not as hard as you can so you don't get too fatigued. The idea is consistency more than intensity. So if you can do this daily for a while, that will help start strengthening. You can also get putty. You could probably just use any kind of silly putty, Play-Doh that has enough resistance. They do make special TheraPutty that you might get from a healthcare provider. But a dishcloth or a stress ball works in a pinch. Another strategy to strengthen the opposite group, so gripping for your flexors. To get the extensors, one easy way is with a rubber band. Put that around the fingers and thumb, and then you're trying to separate all of the fingers, and that's going to strengthen the back of your hand. And same idea, do enough that you feel a little fatigued but not painful, and try it once or twice a day. Another strengthening strategy would be some small weights to strengthen the muscles of the forearm. And if you don't have weights, grab something light, like 15.5 ounces of garbanzo beans. So the tricky part here is to not let this become like an elbow or shoulder exercise. So you want to isolate so that you're not moving your elbow, and then curl. So this is called wrist flexion, curling it in this way. So same idea, enough repetitions to feel some fatigue but no pain. So working flexors. It's always good to do both sides of a joint so you have equal muscle balance. Flip it over and go the other way. That's called extension. Especially trying to go slow on the way down, that helps to strengthen irritated tendons. It's very soothing because you're stretching it, but you're also strengthening at the same time. So that downward phase is called eccentric. And then don't forget, so front and back, so flexion, extension, that might be plenty for you. If you're having more trouble kind of on the sides of the wrist, also make sure you have thumbs up and go upwards. So that will get muscles on what we call the radial side. Good. And then to get the opposite group, you can flip it around behind you and then lead with your pinky to get that side. So working all four sides of the wrist, and then grip strength with a washcloth or putty, and extensors with a rubber band. So I would do the strength exercises once or twice a day, and again, just enough to feel fatigue but no pain. And then finally, I'll give you a couple stretches, and you may want to just do the contrast baths and the stretching only at first. So those 6 strength exercises I just showed you, if it's really flared up and you're having a rough time, maybe don't strengthen just yet, let it calm down first, but these stretches should help. So this is a great one if you have tennis elbow, so that's on the outer or the thumb side. So what you do here is bring that arm out. Doesn't have to be all the way up, it can be down here. And then you use your other hand to gently bend into flexion, and that will stretch this right here. Just go as far as you can. If it's too much, you back off. Stretching should feel like a pull or discomfort, but no pain. You can also modify if you need to by bending the elbow. So that way you're not pulling across this joint and this joint, it's just one. So for stretching, I've said this in other videos, hold at least 20 seconds if you can. So exercise science research from the 80s that is still valid today, they haven't disproved it, where they did a study, they put electrode needles into volunteers' muscles and read the activity. It takes 20 to 60 seconds for muscles to go from being busy to finally calming down, and that's the phase that allows all of your collagen to stretch. So think of really hard taffy, and if you just pull it quick it won't do much, but if you just gently and slowly sustain that stretch, it will make those fibers longer and more pliable. So 30 seconds. If you have time, do 2 or 3 repetitions. You can do these whenever throughout the day. And then we also want to get the other side, so your flexors. So a couple ways to do this. If it's really tight, I would keep the palm down and then pull the hand backwards. Same idea, if it's too much, bend your elbow. If you need more, flip your palm over, and that will give you a lot better stretch. Just beware, if you're really flexible and you can hyperextend that elbow so that it bends not only straight but backwards quite a ways, try not to force it into full hyperextension. Good, and then one other stretch. Finally, this is good if you have a tendonitis here along the thumb. This is a common area, these 2 small muscles right here. So you've got a couple tendons on one side and one on the other. This is called the Anatomical Snuffbox, which is just kind of a funny name that's a holdover from an earlier time. But these 3 tendons belong to muscles that live right here. They often become a chronic problem area if we are doing a lot of gripping or repetitive movement, and that is called the Quervain's Tenosynovitis. So it sounds scary, but it's just a tendon inflammation and sometimes the sheath of the tendon. So for that, you want to tuck the thumb in, curl your fingers around, and if you're really tight, that might be enough, or you might not even get that far. But if you need a little more, then you tilt the hand down, and same idea, you hold for 30 seconds. That will stretch those 3 muscles. So, my friends, there is a brief overview of some simple strategies that will help pretty much any chronic wrist or hand problem. Again, it's not totally comprehensive, but these are safe strategies as long as you stay within your pain-free limits. So go ahead and try these if you have anything bothering you in the even elbow, but especially the wrist and hand. I hope this is helpful. Feel free to leave any comments or questions. If you like these videos, please give them a thumb up when you watch one you like, and subscribe, because that helps me know what's going on, who's out there. And feel free to make any suggestions like my friend did that wanted some trigger finger help. So I love making these videos, and I like helping you empower yourself to take better care of your health. Knowledge should be free, so that's why I'm putting it out there. Thank you, my friends. This is Galzeerah Fitness. God bless and be well.